Hello everyone, welcome back to my channel. This is Zonna again, physical therapist from Orange County, California. Today I'm going to discuss 3 hip precautions and how to do a post-op care after your hip surgery. So make sure you stay tuned.
Hi everyone, my name is Zonna. I'm a physical therapist from Orange County, California, and you're watching my channel, Zonna Physical Therapy.
I'm sure your doctor or your physical therapist have already discussed with you 3 hip precautions. I will try to explain it in more details as to why you have to observe these precautions after your hip surgery. So make sure you stay tuned up to the very end of my video. I don't know, there's like airplanes flying around and cars around me. Excuse me for the background noise, but this is the best place that I like to film this video because the lighting is just so perfect. First thing you have to remember is do not bring your knees to your chest more than 90 degrees in sitting, in bed, laying down, or even in standing. Also, do not bend forward at your hips because this could definitely possibly damage the area on your hip that was just fixed with your total hip replacement, especially if the approach was posterior. The next thing is you have to keep your legs apart. Your hospital will give you abductor pillow and you should have this on with you in sitting or laying down, especially when you're sleeping. So you gotta have that abductor pillow. Also, you have to remember, do not twist your trunk. Then the third thing you have to remember is do not turn your leg inwards or no internal rotation. It's very important that you comply with your hip precautions to make sure that you don't disrupt the healing or possibly go back for another surgery. I recommend that you walk about 20 to 30 minutes every day, 2 to 3 times, and eventually you will be able to stand up for 10 minutes without putting weight or too much pressure on the crutches and your walker. When you sleep and you lay on your side, if you can't sleep on your back, it is very important to have pillows between your legs for at least 6 weeks or more, or if when the surgeon lets you know that it's okay not to use a pillow, always make sure to check with them. This is like a general advice. Everyone has different conditions, so make sure you check with your medical professionals. So you have to remember not to turn your foot inward when you're laying on your side. Because it takes so long for the bone to grow back again around the prosthesis after your surgery, you have to make sure to limit your activities. And also, you could take your medication, pain medication, before you do your exercise. And then you can put cold packs for 10 to 20 minutes right after your exercise to prevent a lot of soreness. And if there's no more swelling, you could do heating pads on the days that you don't exercise. So you will have pain for several months and you will feel uncomfortable. It's just because the bone takes a long time to heal, and so it has to create those callus formation as well, and you want to make sure that you don't disrupt the healing and the growth of the bones. But also take note that as you do more activities, the hip can get swollen very easily. The swelling is going to be more prominent on this hip compared to other joints in your body. You have to keep a balance and know when and how much exercise and activities you should do. Always listen to your body and make sure to get some advice from your medical experts. Also, you have to avoid high impact activities such as jogging or running, jumping, or even full contact body sports. However, you must remember to keep your low impact activities such as swimming, bicycling, and of course walking, which is really easy to do, but try to avoid brisk walking in the early stages. Pain medication can help, and you should take them before you do your exercise, especially if your physical therapists are coming or you're going to be seeing your physical therapist for your rehab treatments. Make sure you take the pain meds before that. That way you could participate better. They will also give you advice always follow their instructions. For your home care, you should have like a cold packs or heating pads and have that handy with you. You will probably go home with a bandage over the hip surgical area, and so you always have to do a visual check whether there's a blood drainage and all that. If you have no access right now to see your doctor or the nurse clinic, that at least you sign up for home health care so that they can come to your house. It will help you recover at your home, and they will come to visit you and attend to your medical needs. So it's always good to sign up for that. Also, make sure that you take home with you from the hospital a walker or any assistive device like cane or crutches, whatever your physical therapist recommend. If they don't give you one from the hospital or from where you had your surgery, make sure you get them, and they have everything in Amazon, so you can check them out. Alright, so that is it for my short video today. I pray for your recovery and hope you will get back to your prior level and back to your old activities and have no more pain on your hip. Anyways, if you like my video and you know someone who could benefit from this, please make sure you share it to them, and I will see you on my next one. So don't forget to subscribe and hit the thumbs up button. That will really help me a lot with my new channel, and I hope you keep supporting me. Have a nice day and take care always. I am here to help you improve your health to live a good life.